Hello Nurse Practitioner Taylor. I am finished reading the chart for Mrs. Jones. I believe I am ready to go and see her now. What do you think our plan of care should be for the patient we are about to go and see? Well, this patient does have a history of recurrent urinary tract infections. My initial thought would be to get a urine dip from her right now. I am unsure of further treatment for her because of the frequency of the infection she has been having. Previous treatments have obviously not helped. What exactly would a 24-hour urine tell us? Urine contains certain amounts of chemicals such as sodium, potassium, urea, creatinine, along with other chemical compounds as well as waste products. A 24-hour urine will measure the amounts of these chemicals in your urine over a 24-hour period. And in what specific situation would we order this? It is ordered because it is a simple, non-invasive diagnostic test that will help us diagnose problems with the kidneys. It is commonly performed to determine how much creatinine clears through the kidneys and to provide more information on actual kidney function, but it also can be used to measure hormones, minerals, other chemical compounds, and protein. I see. And what about the urinalysis with culture? What does it tell us? Urine in the urinary bladder is normally sterile or can be transiently colonized with small numbers of organisms. Females are much more predisposed to urinary tract infections than males, mainly because of anatomical differences. The most common urinary tract pathogens grow rapidly. E. coli is the most common urinary tract pathogen. Most infections are caused by a single bacterial species. Urine culture is used for the diagnosis of urinary tract infection, namely cystitis, urethritis, and pyelonephritis, and more specifically to identify the pathogen and guide the antimicrobial treatment. Recent or concurrent antibiotic therapy can lead to a false negative urine culture result. A positive urine culture is based upon the growth of bacteria at a high number of colony-forming units CFUs. Urine culture results should be interpreted in conjunction with clinical symptoms of a urinary tract infection such as dysuria, urinary frequency, suprapubic pain, flank pain, and fever. For clean catch urine samples, a positive urine culture is indicated by the growth of bacteria greater than 100,000 CFUs per ml, and this is suggestive of urinary tract infection. Growth of 1,000 to 100,000 CFUs per ml may still indicate UTI, especially for a specimen taken at cystoscopy or other invasive procedures. Growth of 2 or more different bacteria or polymicrobial growth is likely the result of contamination. A positive urine culture is further tested to identify the organism and to test its susceptibility to antibiotics, in order to guide antimicrobial therapy. Why would we order it now? The urinalysis is ordered as a screening and diagnostic tool because it can help detect substances or cellular material in the urine associated with different metabolic and kidney disorders. Substances such as protein or glucose will begin to appear in the urine before people are aware that they may have a problem. It is used to detect urinary tract infections and other comorbidities affecting kidney function. Urinalysis may be ordered more frequently and routinely for them in order to monitor their overall renal and urinary function. It is also often done when someone is admitted to the hospital, pregnancy evaluation, and a workup for surgery. The urine culture test is used to diagnose a urinary tract infection in the presence of symptoms indicating the possibility of a urinary tract infection such as pain and burning when urinating and an increased frequency of urination. It is ordered so that providers can order the proper antibiotics for the causative pathogen. I understand now. The urinalysis with culture will allow us to properly treat the infection, and the 24-hour urine can help us understand if there is more that we should be concerned with. I would like to continue with both diagnostic tests for this patient. I agree with your decision.